Yes, women get erections too. Here's what that means.
Yes, women absolutely have erections. This phenomenon is known as a clitoral erection or clitoral tumescence. Clitoral tumescence, also known as clitoral erection or female erection, is a physiological phenomenon where the clitoris becomes engorged with blood, leading to an increase in its size and firmness. It is analogous to penile erection in males.
How it happens?
Similar to the penis. The clitoris is composed of erectile tissue, similar to the penis. When a woman becomes sexually aroused, blood rushes to this erectile tissue, causing it to engorge and swell. Clitoral tumescence is a complex process involving psychological, neural, vascular, and endocrine factors. During sexual arousal, there is increased arterial blood flow to the clitoris. The erectile tissues within the clitoris, specifically the corpora cavernosa, relax, allowing blood to fill the vascular spaces. The ischiocavernosus and bulbospongiosus muscles then contract, compressing the dorsal vein of the clitoris and restricting blood drainage, thereby trapping the blood and causing the clitoris to become tumescent.
What it looks and feels like.
While the internal parts of the clitoris swell significantly, the visible glands of the clitoris may protrude from the clitoral hood and appear engorged and possibly a deeper pink or red color. The labia minora may also swell and become everted. To the touch, the glands generally feels harder and bigger. The sensation varies among individuals, but it's typically associated with a feeling of being turned on and increased sensitivity.
Increased sensitivity.
The engorgement of the clitoris makes it highly sensitive to touch, which is crucial for sexual pleasure and orgasm.
Not always outwardly obvious.
Unlike a penile erection, a clitoral erection may not always be as visibly dramatic, as much of the change occurs internally. However, for the person experiencing it, and often for their partner, the changes in sensation and appearance are noticeable.
Physiological response.
Clitoral erections are a normal and healthy physiological response to sexual arousal, driven by a complex interplay of psychological, neural, vascular, and endocrine factors. They can occur from physical stimulation, mental arousal, fantasies, or even during sleep, similar to nocturnal penile tumescence in men.
Causes of clitoral tumescence.
Sexual arousal and stimulation. This is the most common cause. Any form of sexual stimulation, whether physical, visual, or psychological, can trigger the physiological response leading to clitoral tumescence. Nocturnal clitoral tumescence, NCT. Similar to morning wood in males, NCT is a spontaneous swelling of the clitoris that occurs during sleep, primarily during the REM sleep phase. It's a normal physiological process and may or may not be associated with erotic dreams. In essence, the clitoris and penis develop from the same embryonic tissue, and both are designed to become engorged with blood during sexual arousal.